and non-for-profit community-based organizations who work together to provide quality education for cancer survivors. As with all of our other programs, we will be recording tonight. And tonight's presentation is on inflammation, gut health, and cancer. So I'm going to go over very quickly some Zoom etiquette. All of your microphones will be muted during this presentation. And if you have a question during the presentation, we ask you to please use the chat function to type that in. And then we'll be addressing the questions that you have to the speaker at the end of the program. And tonight, instead of a sign-in sheet, we're using the participant list that's on the screen. And so if your login name happens to be something creative, or it's only your first name or a nickname, something along those lines, we ask you to please email Brittany Rudenica, who is here on this call. I'm going to put her email into the chat box and let her know your full name. If you know how to change your name and you're comfortable doing that, please feel free doing that. But otherwise, email Brittany and let her know so we can count you as attending. And tonight, instead of a paper evaluation for the program, we're going to have an evaluation at the very end. It's a brief 5-question survey, and it shouldn't take any more than just a couple minutes. We ask that you press submit when you're done, and all of your answers are going to be confidential. No one will be able to see your individual responses, but that feedback is very important to us because it helps in the future with providing presentations and topics you'd like to hear more about. The recording of this program is going to be available in approximately 2 weeks, and it'll be on the Torrance Memorial webpage. I will put that also in the chat box once we start. And the link to the program video will be emailed to you. So again, if we have your email address and we're able to identify you tonight, we'll send you that link when it's available. I just want to mention too that we do have one more program for this year in November. It's actually on November 14th, and it's going to feature Susan Starr as our speaker. She's a nurse practitioner at Cancer Care, and she's going to be addressing latent long-term effects. So be on the lookout for that presentation. Let's see. We are pleased to introduce to you our speaker. That's Marissa Minderler. She's a registered dietitian who is driven by her motivation to educate and assist people in reaching their health and wellness goals. Graduating from USC with both her bachelor's in kinesiology and her master's in nutrition, she has always had an interest in the role of nutrition in fitness and in performance, women's health, and oncology. In college, she was a successful track and field athlete who competed in the throwing events and has been a dedicated personal trainer for 13 years. She currently teaches the Core 4 adult weight management class, as well as nutrition in recovery. She finds immense value in educating individuals on the role of nutrition in all aspects of health. So please help me welcome our speaker tonight, Marissa.
Thanks so much, Nancy. Hello, everyone. Good evening. It's nice to be here. I'm very, very excited for this presentation. And I will share my screen and we can get started. All right.
Looks good.
Looks good. Great. All right. So thank you guys for coming. Again, our topic today is going to be inflammation, gut health, and cancer. Once again, my name is Marissa Minderler. I appreciate the introduction, and let's get going. So our goals for today, we're really going to focus on defining inflammation. Okay. We're going to discuss the causes of inflammation, discuss the connection between inflammation, cancer, and other chronic diseases. We're going to also work to define the microbiome. And then most importantly, we're going to talk about foods that help promote the health of our microbiome. So let's start off with just kind of a general idea of what inflammation actually is. So inflammation is really the response from the immune system cells to some sort of foreign pathogen or localized injury, right? You can think of this as, maybe getting a cut on your finger, right? Or, our body's response to any sort of foreign pathogen that could even be a virus, right? Or a bacteria. So when we're born, we have innate immunity, right? And so you can see the image on the right. We've got all these different types of immune cells that our body, we are naturally born with, right? But over time, as we get exposure to different things, we develop adaptive immunity. And these are going to be different cells like our B cells or our T cells. And some people might be familiar with this because of the lymphomas, right? We hear of lymphomas, B cell and T cell lymphoma. So these are just kind of some introductions to the type of cells that are involved in our inflammatory response. We also know with inflammation, right, there's acute inflammation and then there's chronic inflammation. I think chronic we're going to discuss a little bit more in detail, but briefly, acute inflammation is really this localized reaction to injury or infection. So like I mentioned, you get a cut on your finger and something happens, right? And we know that there's these 5 cardinal signs of this inflammation, right? It hurts, so there's pain. There's heat. Usually we get a flush of heat. There's some redness, right? We'll possibly even get swelling, right? And then a loss of function. Aside from the cut on our finger, I can also think of maybe jamming your pinky toe into the corner of the bed. So this is really acute inflammation, right? But something that's a little bit more complex and something that we want to really start to dive deeper into with research and things is going to be this idea of chronic inflammation, okay? So chronic inflammation is really the extended duration of low-level inflammatory processes that negatively impact multiple organ systems over time, okay? And as I mentioned, this is a lot more complex, right? It's often harder to establish really what the root cause is of this chronic inflammation. So the root cause or a driver of this chronic inflammation is really what we're going to dig a little bit deeper into. So we think of a driver of inflammation as being something that is increasing this low-level inflammatory response, right? And we know that there are a few main drivers of inflammation. So stress is a huge driver. Okay, we're going to talk about that in detail. Excess visceral body fat is also a driver of inflammation. Dietary factors, poor sleep, sedentary lifestyle, and possibly even environmental toxins, right? So we're going to spend the next few minutes going into some of the deeper issues and spend a little bit more time talking about really how these are driving specific routes of inflammation. So stress, we're all pretty familiar with stress, I think. I don't think anybody has ever not been stressed, right? But we know, unfortunately, stress can increase the production of a hormone called cortisol, okay? And cortisol is really this hormone that can stimulate the release of glucose from our liver, okay? Anytime this happens, this can increase our blood sugar, okay? And when we have an increase in our blood sugar, this causes our pancreas to release something called insulin, okay? If you have diabetes, right, insulin is something that we know a lot about. Glucose, right, is just something that every cell needs for energy, right? But in times of stress, when we release too much glucose and we release insulin, okay, this is not really ideal, okay? And the reason for this is because the release of insulin is a pro-growth hormone, okay? It's something that promotes body fat accumulation, visceral adiposity, and it can reduce the breakdown of fat cells, okay? So anytime we stimulate insulin too much, this can cause us to have a challenge with weight loss, okay? If we have too much visceral fat, this is the fat that is close to our organs, okay? This promotes really a systemic and persistent low-level inflammatory response, okay? This connects really closely, as I mentioned, to the visceral body fat, right? So if we have excess visceral body fat, all right, this increases the production of free fat in our blood. Okay, that in turn will also increase our fat deposits in different areas around our body, specifically in the muscle, the liver, and the pancreas. Okay. And when we have these increased fat deposits near our organs, again, this continues to promote this low level inflammation. So you can see in this picture here, right? Anytime we've got a lot of visceral adiposity, so these big circles, right? These adipose tissue, this fat cell, okay? It tends to stay close to our systemic circulation, okay? And then it also causes different inflammatory cells to come and infiltrate these areas, right? So the macrophages, like what we mentioned, T cells, okay? All of these will increase an environment that can also promote tumors, okay? And it can promote what we call insulin resistance, okay? And insulin resistance is a huge challenge because, again, it can prevent weight loss, right? And it's also something that can help cause diabetes. Okay. Let's talk a little bit about diet. We're going to go much more into detail a little bit later down the road, but we're going to talk briefly right now about how dietary factors increase inflammation, right? So we know that the increased intake of specific foods that are high in saturated fat, low in fiber, and high in refined carbohydrates, that all of this together can increase inflammation, okay? We think a lot about white breads and pastas, common snack foods, you know, like chips and cookies and candy, pizza, burgers and hot dogs and other processed meats, right? But really specifically, a low intake of fiber is known to be a really strong driver of inflammation. So you really want to focus on having high fiber in your diet. And we're going to talk about that a little bit later. Saturated fat, right? Saturated fat also increases LDL cholesterol. Okay, LDL cholesterol is really the cholesterol that continues to circulate in our system, and it increases our likelihood for plaque buildup, okay? This will increase that inflammation within the blood vessels, right? So this can cause atherosclerosis, can cause hypertension, and it can eventually even lead to heart attacks or strokes. Poor sleep. I think all of us have been victims of poor sleep at some point in our lives, right? But we really think this from a chronic perspective, okay? They've done a lot of studies that have shown that sleep disturbance, as well as a reduced duration of sleep, okay, increases specific inflammatory molecules. Some of those are called IL-6, which stands for interleukin-6. Cytokines, some people might be familiar with the concept of cytokines because they were talking a lot about this during COVID. Okay, these are sort of these signaling molecules that signal our body like we've got something wrong, right? There's some level of inflammation happening here. And CRP stands for C-reactive protein. So we know that any sort of sleep disturbance, as well as a reduced duration of sleep, can increase these sort of inflammatory molecules. There's also been numerous studies that have shown that the reduced amount and quality of sleep was associated with the difficulty losing body fat, decreased ability to put on lean body mass or muscle mass, an increased production of cortisol. And we just learned that cortisol can sort of cause this cascade again with increased blood sugar and insulin stimulation. And then we also know that reduced quality and amount of sleep can increase our appetite for sugary and processed foods. I'm sure we've all felt that a little bit. After a poor night's sleep, you know, maybe we're looking to grab the cookie or the soda or something quick and easy, right? Sedentary lifestyle. Sedentary lifestyle is also something that really is unfortunately becoming a little bit more prominent in society, but we know that also this can increase our chance of increased inflammation or chronic inflammation, right? Decreased physical activity is associated with an increase in body fat, a more rapid decline of lean body mass with age, and poor cardiovascular health. There's also a lot of really in-depth research showing that, you have an increased risk for Alzheimer's dementia the more sedentary that you are. So we really want to focus on having a less sedentary life and have a lot more physical activity to help reduce our chronic inflammation. And you can see here kind of on the right in the picture, right, the increased risk of dementia, right, increased risk of cardiovascular disease and blood pressure concerns, reduced VO2 max, which means kind of your body's cardiovascular capability, increased risk of diabetes and insulin resistance, and then sarcopenia, which is that age-related muscle loss, and decreased insulin sensitivity, right? So sedentary is not the way to go. Ideally, we really want to try and get a little bit more physical activity. So after all that, okay, what is really the connection between inflammation and cancer? Well, just like there is no single cause for cancer, there is no single mechanism that is really going to dictate the connection between inflammation and cancer, okay? We think of inflammation really, as I mentioned, as a combination of processes that affect the body's total state of being, okay? But really its impact on cancer risk is what our primary concern is, okay? This impact, though, really varies immensely between individuals. And this is something that we can kind of consider to be your relative risk. So we know that cancer risk is related to the culmination of diet, lifestyle, environment, and very much genetic factors, okay? And if we think about the scales, okay, we think about our relative risk, our individual relative risk for cancer and prevention. We know that diet and lifestyle are on both ends of this spectrum, right? Maybe environment as well is too. Genetics 100% is on the relative risk side, right? We can't necessarily change our genetics, but we can change our diet, our lifestyle, and maybe we can potentially change our environment, right? But we really want to focus on that diet and lifestyle being really higher, having more weight, right, than our relative risk. So it's about a total dietary pattern. You want your prevention and your preventative strategies to outweigh your relative risk. So let's get into gut health. All right. So there's this guy, his name was Hippocrates. he was in Greece, and he had this quote that says, "All disease begins in the gut." And I think he was onto something. While I don't know if he was 100% accurate, I really do think that he was onto something, and he was very much ahead of his time. So let's talk a little bit about the microbiome, okay? The microbiome is really all the bacteria, the fungi, the microorganisms that encompass our mouth, our skin, and our gut, okay? It also includes their genetic composition. But when we think about the microbiome, I think most of the time we're referring to colonic bacteria, okay? And so the bacteria that exist in our lower digestive tract, okay? And these are really the most dense, okay? Most dense in number. There's billions of them in there. And this is really what we refer to as the microbiome more commonly, okay? We think of a diversity of species in the microbiome as being good, okay? And the more bacteria that you have and the more diverse their genetic composition really is a good thing. And the reason for that is they think that evolutionarily, this was how we can be more resilient, right? We have more ability to perform different functions, okay? So the goal of having a healthy microbiome is to have a more diverse set of bacteria, right? But how do we get that? Well, we're going to talk about that in a minute. But we know that the microbiome and this diversity of species in the colonic area really can change and evolve very quickly, okay? It can change even on a daily basis based on what you eat, okay? And we'll go into that a little bit more detail. But there's this term that's going around for much of gut health about dysbiosis. And I'm sure some people have heard this before, But dysbiosis is really loosely defined as microbial imbalance, or I guess it's like the not normal for what your normal is. And that's really important because each person's microbiome is different from another, okay? I say your microbiome is like your face. It's different than everybody else's. And this is really important because this is where diet gets complicated and why there's a lot of misinformation about taking probiotics, or this food works for me, therefore it should also work for you. And that's not necessarily true, okay? The foods that work for you are going to work for you, okay? So dysbiosis is really this concept that we're going to talk about, okay? And so again, dysbiosis is this change in your colonic bacteria that may lead to unwanted digestive systems and possibly other chronic conditions, okay? It could be connected to cancer. It could be connected to Alzheimer's and dementia. IBS is also another thing that we talk about a lot with dysbiosis, okay? But really it's this imbalance in the microbiome diversity. So this is just a kind of a cool picture, and I wanted to include this because I wanted to show how closely connected our microbiome is to various immune cells. So we know that our immune system has this crosstalk between the microbiome, okay? So this picture here, you see the arrow with the microbiome. This is thinking of the inner lining of our lower GI tract, okay? The inner lining of our colon. Okay, and we've got these epithelial cells. These are just the thin cells that separate the space between our outer GI tract and the inside. Okay, and you can see here that in the outer layers of the GI tract, we have those immune cells, right? And we have those immune inflammatory, I should say the inflammatory signaling molecules, the IL-10, the IL-22, the TNF alpha, right? All of these are present here. And so everybody's probably heard of that term, like 90% of your immune system is in your gut. Well, this is that connection that we're talking about, right? And so we know that there's a conversation between the microbiome and those inflammatory cells across that epithelium. And what we eat, what we put in our body directly influences that conversation between the microbiome and the immune cells. We don't know all the details, right? But we know that there is a conversation. So as I mentioned before, the microbiome is highly modulatory, okay? It can change very rapidly, okay? We know that it's influenced by our food choices. We know that stress plays a role in the microbiome. We know that medications, chemotherapies, radiation can also affect the microbiome. Okay, medications, I even think like antibiotics, right? We know that antibiotics wipe out all the good and an attempt to get rid of the bad bacteria, right? We know that that has a strong influence on the microbiome. And there's many studies that have connected a high incidence of needing antibiotics with a higher rate of dysbiosis or less diversity of the microbiome. Okay. Supplements, I say, do supplements impact our microbiome? We'll talk a little bit later about probiotics. I'm sure there's lots of questions that might come up about probiotics, but we don't really know the efficacy yet. We don't know if those actually have a positive, negative, or null impact on the microbiome, okay? One thing is for sure, with many studies, especially relating food, okay, related to food, we know that one of the most impactful foods that can enhance our gut health and create a favorable microbiome is fiber, okay? And I say food because fiber is not necessarily a nutrient. It is a compound that our body does not digest, but it is something that our microbiome uses as food, okay? So the bacteria of the microbiome consume fiber as energy, okay? They eat it. they eat it up and they produce something called short chain fatty acids. Okay, these short chain fatty acids are a few tiny little molecules, again, that give the bacteria some energy. Okay, and this is actually a good thing because it actually assists with promoting gut health. So fiber, as I mentioned, is that non-digestible portion of a plant. Okay, so you think about the lovely picture here. Let's look at the bean. Okay, we think about a bean, all right? And fiber is found in two different forms. There's soluble fiber and there's insoluble fiber. So if you think about a bean, right, we've got the casing of the bean, and we also have like the flesh or the inner part of the bean, right? And you can technically separate those two. So the soluble fiber is going to be found in that fleshy inner part of the bean, right? The insoluble fiber is going to be a part of that casing, okay? So soluble fiber, when it combines with water, it forms this viscous type gel. Okay, I'm sure some people have probably seen like chia seeds, right? Maybe you've seen chia seeds in water. Okay, they form this like goopy jelly-like substance. Okay, and that's the soluble fiber. So that's actually really good for us. Think of it as grabbing onto things, right? Because when we eat fiber, it forms this gel, right? And it's gonna pull any sort of waste. It's gonna grab onto any cholesterol, okay? And this is gonna help our body eliminate that, okay? Additionally, that soluble fiber is something that the bacteria can feed off of, okay? So we think of soluble fiber as a prebiotic, okay? So it is the food to the microbiome. So again, soluble fiber is really found in fruit flesh. It's the inner part of the beans. It's found in whole grains like quinoa, brown rice, found in oats, right? And chia seeds, as I mentioned. Okay? We also have this insoluble fiber though, right? And so again, insoluble fiber, think of it as kind of moving unchanged through our GI tract. So for lack of a better term, I guess, our GI tract is a big pipe, right? And insoluble fiber pretty much acts like a pipe cleaner, right? So it's going to move unchanged through our tract. It's going to scrape out all of the waste. It's going to help us use the restroom and have a bowel movement, okay? And so this is oftentimes what people increase when they in their diet. They think, I'm going to add the broccolis, I'm going to add the asparagus, I'm going to add the kale, the cauliflower, all of these really dense cruciferous vegetables. And sometimes that can be a little bit much initially. But again, that's because it's comprised mostly of insoluble fiber and it moves unchanged through our tract. So you really want to make sure you chew your food really well. If you're increasing your insoluble fiber, that's a way to help kind of manage your GI symptoms if you're having an increase in insoluble fiber. So fiber also helps keep us full. Okay, that's another one of the benefits because fiber is great for weight management. Okay, it keeps us full. It helps with blood sugar regulation by slowing down how fast food empties from our stomach. Okay, so if you just had a little bit of a higher carbohydrate meal, as long as you have some fiber with that, it's going to slow down how fast those carbs are broken down and how fast your blood sugar goes up. As I mentioned, it's wonderful for cholesterol management, okay, because it kind of helps grab onto that extra cholesterol that's going to be recycled in our lower GI tract, and it helps us eliminate that from our body, okay? And it helps with waste removal. So think of this tree, okay? The more fiber that you eat, okay, high fiber intake from a variety of plant sources, okay, and that's really the point here is fiber is only found in plants. It does not exist in any animal product. It is only found in whole plant foods, okay? So you have high fiber intake throughout your day. This is going to help feed all the good bacteria, and this helps signal more of that bacteria to multiply, right? We want more good bacteria for our digestive health, right? This is going to help that good bacteria produce those short chain fatty acids. Those short chain fatty acids help produce a strong immune system. It helps create this anti-carcinogenic environment, and it helps reduce our body's synthesis of VLDL, which is really those very low density lipoproteins, that cholesterol that we know increases our risk for heart attacks and strokes. Okay? In doing so, you'll also increase your feelings of satiety. You're going to have better appetite regulation. It's going to promote more insulin sensitivity because your body's not going to have to work as hard to produce insulin to digest those carbohydrates. And it's going to help decrease your insulin resistance. All of this combined together over time is going to reduce your risk of cancer, your risk of obesity, cardiovascular disease, and type 2 diabetes. So this was a study from PubMed. The link is down at the bottom of this slide. I also have references at the end of this, but they did a study where they assessed 25 grams of fiber intake per day. Okay, and they wanted to see really what was this going to do in the long term. Okay, I can't remember the exact length of this particular study, but I want to say it was 3 to 6 months. Okay, so each person in the study had an intake of fiber over 25 grams per day. Okay, and they found that this reduced not only all-cause mortality, but it decreased coronary heart disease incidence, it decreased type 2 diabetes incidence, and it decreased your risk of colorectal cancer. Okay, and colorectal cancer is on the rise. And colorectal cancer specifically is very, very closely connected to low fiber diet. Okay, you really want to focus on reducing your intake of processed meats and increasing your fiber and increasing all those positive gut bacteria. So I know there's going to be some questions, I guess, about probiotics, right? So probiotics, as I said, are the microbiome, right? They are these species of bacteria that are found to exist in the lower GI tract that are thought to be more favorable to our health, right? So these are the good bacteria, okay? These are the ones that we want to multiply and be in abundance, okay? These probiotics are also naturally found in specific foods, okay? And they're found in cultured foods, okay? So the cultured foods that exist are cheese, kefir, yogurt, cottage cheese, sourdough bread, natto, and then kombucha, right? So these are some of the foods that you can eat, right, that can help promote some of those positive bacteria, okay? When it comes to supplements or supplementation of probiotics, okay, they might assist with eliminating various digestive distress, possibly connected to improving IBS or IBD. But we're still really trying to get into the nitty-gritty and determine really if oral supplementation actually generates any efficacy in the lower GI tract. You know, you take a capsule, it has to pass through your stomach acid, right? Make its way down the small intestine, which is huge, you know, what, like 36 feet or something like that. Make it all the way down to the colon and hope that some of those bacteria stick. So we're really not sure of how much efficacy exists in supplementation. They're doing a lot of research with IBD and trying to figure out if that also helps with supplementation, but they're still also trying to figure out which strains, how much, and do they need to be in combination with each other, or is it better to just have one of the bacterial species versus another? So very interesting research, but there is a prominent professor actually at Cedars-Sinai. Her name is Suzanne Devkota. She's working right now with IBD and really studying in-depth microbiome. And she had a talk most recently about how the best thing that you can do is eat cultured foods. Okay, is to choose some of those cultured foods and incorporate those into your diet. And this can be done in a variety of ways, whether you are vegan or if you eat animal sources, you can do all of the above. So she really recommended consuming some sort of probiotic on a daily basis. So here I have a sample menu for you guys, okay, for anybody that might be the omnivores or for anybody that's vegan. This is really a way to add fiber into your diet and also include a cultured food. Okay, so if you're an omnivore, consider adding cultured yogurt, right? Think about incorporating chia seeds with some berries. You're going to get some soluble fiber and a lot of antioxidants in there as well. If you have lunch, maybe throw in, a mixed green or arugula Mediterranean bowl, right? Add some beans in there. Throw in a mixture of different vegetables, right? Add some cheese. Dinner, throw in some fish, right? Add some steamed broccoli for your insoluble fiber. Get extra quinoa, right? For extra protein and extra fiber as well. And then if you're a vegan, look into soy milk, right? Nobody should be afraid of soy, okay? Soy is a wonderful, wonderful food. So incorporate soy milk to get your protein, okay? Your vegan protein. Add that and make up some peanut butter and jelly overnight oats, right? You can also make a Mediterranean bowl very similar to the omnivores, just either leave out the cheese, right? Or you can keep it as is, right? Just veggies, okay? Dinner, add some tofu, right? Instead, use the marinated tofu instead of fish, right? And choose your broccoli and your quinoa. So just a brief summary of everything that we talked about. Really, chronic inflammation is complex, okay? It does have the power to influence various organ systems, though, and different tissue systems throughout our body. And this inflammation, again, is not as well understood. It is very complex, but it does increase our risk of conditions like type 2 diabetes, cardiovascular disease, Alzheimer's, dementia, and cancer, okay? We know that our microbiome is going to very closely interact with our body's immune system, okay? This crosstalk and this conversation means that we have to choose foods that support our microbiome, right? And we want to avoid any sort of food that might increase our risk of dysbiosis, right? That negative, that microbial imbalance that negatively impacts our immune system, okay? It does make our body more susceptible to this chronic inflammation and to disease, okay? As I mentioned, fiber really can assist with promoting that microbial balance and restores gut health and helps create that anti-carcinogenic environment. Okay, fiber, though, I will say, is very much like a workout. Okay, if anybody has been exercising or hasn't exercised for a long time and has started to begin to exercise, it's really hard in the beginning. It kind of hurts, right? You're really sore all the time. So think of fiber as a progressive increase, right? If you're not used to getting a lot of fiber in your diet, you have to start slow, right? Usually start with soluble fiber, a little bit more of the easier to digest fiber, and gradually increase it over time, right? Don't go from 10 grams of fiber a day to 45 grams of fiber a day. You might experience some of that unwanted digestive symptoms. So the best thing to do is to create this microbial change over time, okay? Gradually add that fiber over time, okay? Ways that you can also support your gut health while adding fiber are incorporating those probiotics, okay? But choose them from food sources, okay? Favor the food sources over any of the supplements, okay? Again, we don't know the efficacy of the supplements yet, and they're very expensive. They're costly. Most supplements as well are not third-party tested, right? We don't know what's actually in the supplement is truly what's on the label or what you're getting, okay? So if you do choose to buy probiotics as a supplement, I always recommend purchasing ones that are third-party tested I'm happy to explain that a little bit later if anybody has further questions about that, but we'll really emphasize focusing on food sources, okay? Focusing on getting your probiotics from food. These are some resources, okay? These are the ones that I had used through the presentation. You guys are more than welcome to take a picture of it, screenshot it, whatever you need if you want to go back and read some of those studies and some of those articles. And this is further information about our nutrition services. So if you'd like to, reach out to any of us as dietitians, please visit our website, or you can call us at this number below. I appreciate everyone's time, and I hope that we have some good questions. So Nancy, should I stop sharing my screen? How would you like me to?
Yeah, you can stop sharing your screen if you would like. And I do see some questions that have come in.
Great.
So the first one, well, I want to invite anyone who does have a question. You can either use the Q&A feature or the chat box to put your question in. So the first one I'm seeing is that I believe you may have just answered this, but is it good to have psyllium if I didn't eat much fiber on a certain day?
Awesome question. Yeah, so psyllium is psyllium husk, right? It is considered to be a soluble fiber. So it is something that really forms that viscous gel. It's also something you can just buy, over the counter. I've used it in making a bread. So I make this kind of seed bread that also combines psyllium. So, and it's also found in most of the supplements that are, so Metamucil, any of the fiber capsules. So it is fine. It absolutely is 100% okay to use. You may not find the same appetite, I guess, suppressant, right? Or feelings of satiety, excuse me, that's what I was looking for. Feelings of satiety from, mixing that into water and consuming, but it's definitely still going to give you the benefit of having that fiber.
Okay, great. I did see 2 comments come up when you were showing the sample menu, and I think someone's stating that they're dairy intolerant as well as wheat intolerant. So perhaps do you have some substitute meals for someone who has that?
Yeah, so anytime you have dairy intolerance, of course, don't consume dairy. But I guess I would need a little more details about which specific, so a protein food or something like that. But they do now have I believe it's cashew yogurt, and I think they also culture that. And then I believe they are coming up with an almond. I think they have an almond yogurt that also is cultured, or a Greek almond yogurt, so it has a little bit more protein to it. And then what was the other part? Wheat intolerance.
Wheat.
Okay. So choosing, gluten-free foods, right? So quinoa, right, would be fine. Or any like barley, right, would also be fine. That has high fiber.
Okay, great. Somebody's asking then, is insoluble fiber bad for colitis?
Ooh, okay. So if you have some inflammatory, like some IBS or an inflamed lower GI tract, oftentimes they do recommend a low fiber diet to calm some of that down initially. You might be on antibiotics as well. They might be giving you some kind of steroid as well for decreased inflammation. But yeah, we do recommend actually a lower fiber diet initially until some of those symptoms subside. And then you want to do, as I mentioned, a very slow and gradual increase, focusing more on the soluble first than the insoluble. You want to really slowly add that insoluble back in over time.
Okay, good. Somebody here's asking, wouldn't fermented foods such as sauerkraut and kimchi be good probiotics as well?
So that's a slight misconception. So so fermented foods are not necessarily probiotics. They might be beneficial. They may act as prebiotics, and they are thought to be positive for gut health, but they are not technically probiotics. So they, if anything, they would be considered prebiotic, right? So that the food of those bacteria. Good question. I'm glad that came up actually.
Okay, someone here is asking, what are your thoughts on castor oil packs?
Unfortunately, I'm not familiar with that, so I cannot speak to that. I'll have to look into that a little bit, but yeah, I'm not familiar with those. Sorry.
Okay. Somebody's asking, what are postbiotics?
Ooh, okay. Postbiotics, I think that might be a slight misnomer, perhaps, or marketing. I'm not sure there is such a thing as a postbiotic. I would say, again, you have the food of your GI tract, the prebiotic, and then you have the probiotic, right? I would maybe venture, if I had to guess, that a postbiotic would be something that keeps the good bacteria in there, but I'm not even certain that's exactly a thing.
Okay, I just was curious if this was someone else's question, but what about something like a digestive enzyme? Would that be considered postbiotic?
No, so a digestive enzyme is just an enzyme that's going to be released from your pancreas that helps you break down carbohydrates, fats, and proteins. So it's just going to help make that food easier to absorb in your system.
Okay, great. Someone's asking here, what is the recommended grams of fiber per day for adults?
Excellent. 25 to 30 grams of fiber per day is what we recommend from a mixture of, soluble and insoluble. As I mentioned, in that study, they said the 25-gram mark really lowered your all-cause mortality, your risk of cardiovascular disease, colorectal cancer, and diabetes. So, 25 grams is the minimum for sure.
Okay. Somebody was asking about the website that you posted above. So I think that might have been the Torrance Memorial.
Should I share my screen again?
Yeah, if you want to share that second to last slide, I think it was, or last slide. There it is. Okay, this next question is asking, what is the best thing to do when first starting to change your diet in hopes of reducing inflammation that can help with the transition from a bad diet to a good one? Anything that can speed up the process of removing all the bad and replacing it with good.
I love this question. I think, it's really important to take your time, number one, right? This is a better process done slow, okay? Not anything that should be done rapidly or something that, all of a sudden just cut all of these things out and add all of these things, right? The transition of this diet, it's like a workout, right? It takes time, you have to have a plan and a nice, slow, consistent development. So the best thing to start with, I think, is to really assess, how much fruit and vegetables and whole grains and beans do you have in your diet, right? Because we know that those are the things that have the most fiber, right? Fruits, vegetables, whole grains, nuts and seeds as well, right? But we know that those are the foods that we really need to have at every meal, right? So assess where you're at there, okay? If you find that you don't have a lot of vegetables in your diet, maybe that you're only having them at dinner, maybe you're only having one vegetable, right? See where you can add some of that, okay? Maybe start with lunch, right? Say, okay, well, maybe I'm having my vegetable with my dinner, but maybe I'm missing it at lunch. Okay, see if you can just add, some carrots and some celery and cucumbers as a side to a sandwich, right? If you typically have a sandwich with chips, right, swap those out for a piece of fruit or the vegetables, like I just mentioned. For breakfast, right? If you're skipping breakfast, that's one of the easiest places to now start to add in fiber, right? Or cultured food, right? We can have the Greek yogurt with some berries and chia seeds, right? So I would say really assess where you're at from a perspective of plants, okay? How many plants am I getting throughout my day? And then think about where you can add or places that you can swap that out. That would be my first recommendation.
Okay, great. Someone here is asking if you can comment on Food Map.
Food map, do they mean FODMAP? That might be
Uh,
more,
Possibly because she put SP question mark spelling, not sure.
okay. Probably FODMAP, FODMAP. So FODMAP is an acronym that stands for fructose, oligosaccharides, polysaccharides, or disaccharides, excuse me, monosaccharides, and polyols. So it's an acronym of different compounds that are found in fruits and vegetables, fermented foods, cheeses, all of these things. And for inflammatory bowel disease specifically, and possibly for IBS, there's been some research that shows that a low FODMAP diet might be beneficial. However, the FODMAP diet is really supposed to be a short term. It's not supposed to last more than 6 to 8 weeks. And then you're supposed to do a very slow and gradual transition of adding those foods that have those high fructose or high oligosaccharides back into your diet. I highly recommend finding a registered dietitian that specializes in something like that if you do want to undertake that and if you are having sort of GI symptoms. But just because the diet is very tricky and it can be quite frustrating, and I find that it's important to have somebody kind of following you along and making sure that you're doing it correctly. For resources on that, the Monash University, MONASH, Monash University, they created really the FODMAP diet, and they actually have an app that you can download. I believe it's $8. And they give you recipes and you can go on that diet with some assistance if you would like.
Okay, thank you for that. Somebody else is asking, is it possible to shrink benign pancreatic cysts through diet?
I don't know. This is where I find that, diet is a tool. Maybe yes, maybe no, right? I think that cancer and even benign tumor growth is complex. The mechanisms for which these happen are multifactorial. So again, I don't know if diet alone can shrink these, but it certainly is a powerful tool. But so is exercise, so is sleep, so are other, lifestyle factors. So I would say that it certainly is worth exploring, and making sure that you're consuming a wholesome, healthy diet. But I cannot necessarily say absolutely the diet alone will shrink a tumor.
Okay, thank you. Is there a difference between yogurt and cultured yogurt?
Yes, the regular yogurt doesn't have cultures, and then the other yogurt does. Most yogurt, though, is cultured. I might be sticking my fist in my mouth and saying that Yoplait does not have probiotics in it. But the best way that you can check that, again, is on the back on the label. It says it will have, a specific strain of bacteria. So always go for the cultured. Always go for the cultured.
Okay. Someone here is asking, how can you get the flesh of beans without the skin?
You definitely have to have them already cooked, right? You can't do it without them without them being cooked. So you either have to cook the beans, or you really truly would just squeeze them out of the casing, or you would just have to squeeze it out of the casing. But I wouldn't necessarily recommend doing that. But if you're doing this in the instance of trying to get more soluble fiber and less insoluble fiber, I would recommend going for beans that have a smaller or thinner casing. So lentils typically have a very thin casing. They're a little bit easier to digest. Same thing with black beans as well as chickpeas or garbanzo beans. But ones that have a little bit of a thicker casing, like the Great Northern beans or the kidney beans, those sometimes can be a little bit harder on your GI tract initially. So if you're thinking about maybe trying to add some beans but avoid the casing, I just would recommend choosing some of the beans that have thinner casings.
Okay, great suggestions. This person here is asking, are smoothies a good way to increase fiber if it's fruits and vegetables?
Yeah, smoothies can be a wonderful option for that. I always recommend they're also a great way to like just add more veggies. You know, throw in a peeled zucchini or throw in some kale, throw in some spinach. You can even some people have even put one of my patients actually had put in cauliflower rice. So just blend it all together, right? And those are ways that you can get that. I would say that they can be really high calorie, right? Or you can also make them, you know, a little bit lower calorie. So they can be a great option for adding some more fiber to your day.
Okay. Here someone's asking, what is the best number of plants we should take daily? I imagine eat daily.
Yeah. I don't know if there's a specific number per se. There have been some studies that have tried to find like compare overall health and wellness and longevity to the total number of different plants that you eat across the week. And I think in some of the like vegan spaces, they've recommended 30 different plants across the week, not necessarily specifically looking at day, but I mean, if it was easier, you could average that, you know, per day. But 30 is challenging. 30 is really hard. I think I tried to look into that myself, and it is actually quite challenging to do. You have to get really creative. But again, just aim for color, aim for variety, right? That's the best that you can do. But I think the high goal benchmark is 30 different plants across the week.
Okay, great suggestion there. Somebody here is asking, is being strictly in a vegan diet a healthy idea?
I'm sorry, are beans?
Is being strictly in a vegan diet a healthy idea?
I think that it really is, it's absolutely possible to be a vegan and 100% have that be healthy. I find that you do really have to focus on your dietary pattern. You know, you really do have to focus on incorporating nuts and seeds and whole grains and beans and fruits and vegetables with every meal to make sure that you're getting enough nutrients and to make sure you're getting enough protein, and to make sure that you're you know, getting everything that you need truly, because so it can be 100% a healthy way to live.
Great. And do you have time to answer a couple more questions, Marissa?
Yeah.
Okay, great. So someone here is asking, is Manuka honey okay to consume once in a while, like just about a tablespoon?
Yeah, honey is great. I know Manuka honey, they tend to add some of the special probiotics to it as well. I think the more bacteria they have in it, the more expensive it is. So it can be quite pricey, but yeah, you can absolutely add it into oatmeal. You can add it into drizzle it on bowls or whatever. But yeah, it's 100% okay to have.
Okay. And I just want to remind everybody before I ask the final question, please stay on afterwards to answer the survey questions, the 5 brief ones at the end that will pop up on your screen. So let's see here. Last one is somebody mentioned having celiac disease and wanting suggestions. I know you made some suggestions to the person who was wheat intolerant, but could you make some more suggestions for somebody who needs to eat gluten-free?
Yeah, so celiac, of course, is, you know, autoimmune specific, and complete, you know, allergy to gluten. So you have to also be really mindful of, you know, cross contamination. This unfortunately happens a lot, you know, at restaurants and things like that. But as far as sources of food, so rice is gluten-free, all fruits, all vegetables are gluten-free. It's again, just really the grains, right? So obviously you want to focus on rice, quinoa, buckwheat, and I want to say, I think it's millet. Yeah. Those are the sources that are gluten-free as far as grains, right? So that's what I would recommend. You can always do gluten-free bread, but you know, some people find that it doesn't have as much density to it, right? but 100% you can do that. Potatoes are also gluten-free. They're a vegetable. And same, you know, so any vegetable is fine. It's really just those grains.
Great. Okay. Well, Marissa, thank you so much. I see so many different comments in the chat box saying thank you. Very
Great.
informative, well presented. Yes. And Brittany, put your contact information also in the chat box as well. So if anyone wants to look through the chat box, that information is there. But thank you again. You're very knowledgeable and you presented such a wonderful topic. So here's the poll, the questions here. If everyone could just take a moment or two to answer these questions, this really helps guide us in choosing our next topics.
Right. Thanks, Nancy. Everyone have a wonderful evening.
Thanks, Marissa. Thank you, everybody who's continuing to answer the questions. If you have finished the poll, you're free to go and enjoy the rest of your evening. Thank you again, everybody, for answering these poll questions. I think we'll stay up just for another minute or two. So hopefully you're able to put your answers in. And if you have done so, you're free to go and enjoy the evening. So it looks like I'm seeing 69 of 69 participating, 100% participation. Oh, 70 of 70, so we're still going.